Hey guys, Dr. Rodman here. Today we're going to talk about degenerative disc disease. Many people have this and often get confused because it has the word disease in it. It's really a degenerative process, which means like a wear and tear over time. So let's talk about what it is. If you look at the disc here, it's in between two vertebrae, and it's basically a big shock absorber. And over time, the degeneration causes that to thin and wear out. And we want that to be big and very resilient, so that it protects our spine, and also so that we do not get pressure on these nerves that come out of the spine. The thinner this gets, the more narrow the hole is where the nerve comes out, and then we get nerve compression, which can cause a lot of different type of symptoms. So if you look here, you can see the actual degeneration process in the lower back or the lumbar spine. You see the vertebrae, and this is where the disc is, and this is a nice healthy disc. And here's phase 1 of degeneration. You can start to see some difference in the shape of the vertebrae, and the disc height is still nice and tall. And as we get to phase 2, you start to see thinning of that disc, and you start to see some bone spurs growing off of that bone. And then you look at phase 3 here, and the disc is completely degenerated. So degenerative disc disease is settled in here. Very thin disc, very narrow hole where the nerve comes out. This person probably has some sciatica and is most likely a surgical candidate. So how do we prevent this from happening? A lot of people wait till it's progressed to get treatment. But what we have here is something called flexion distraction, which actually helps to keep our discs very healthy. So come on in this room over here. I'm going to switch cameraman. Lori's going to take over. And Dr. Chris is going to lend us his spine here. And basically the discs stay healthy with movement, but when we get stiff, we can't move very well. So this table helps to actually pump fluid into the discs and keep us moving that area even when we're very stiff. So we'll show you how it works. Come on in a little closer. So first we start by stretching to open up and stretch that disc. A lot of problems come because the discs are always compressed from sitting, from gravity. And then we can, from here, go ahead and stretch that disc even more. And this movement right here is called imbibition, which is actually pumping nutrients into that disc to keep it very supple and give it some fluid so it can be healthy. This prevents the discs from drying up and can help prevent that degenerative disc disease if we get this before the process has actually started or settled in. And from here we can take this table and we can circumduction, or kind of move it in a side-to-side manner, and help to pump fluid into that disc, keep that disc nice and healthy. A lot of people come in here when it's already advanced and progressed and become a very serious, significant problem. But to prevent degeneration, this table is a very great way. Even a once-a-month treatment can help tremendously to prevent that and help us to age very well and preserve our body. So, Dr. Rodman, degenerative disc disease. I hope I explained it well. If you have any questions, give us a call.